Hi, I'm Dr. Meera.
I'm Dr. Meera.
I'm Dr. Ansu.
Today, we are discussing about why we need to have proper aesthetic dermatology training after our MD courses.
I think during our post-graduation time, we are getting exposure to general dermatology more than the cosmetic dermatology.
Yes, we get to see those dermatology cases. We learn about skin and the science of skin. And the amount of time we spend with our patient, how much would it be? Like 5 minutes?
Usually, it's a visual specialty, so if we find out that this is the diagnosis, we finish the consultation very fast.
So I think in aesthetic dermatology, we had to spend more time. Like it's almost 30 to 40 minutes we had to spend.
Exactly. Every patient is unique. They have their own needs and desires. We need to understand their concept of beauty as well. Accordingly, we have to plan the treatment. So it requires a lot of discussion with the patient.
Even lasers, I think the parameters, everything will be changing according to the patient and according to their skin condition.
Yeah, the lasers, peels, everything. When we discuss with a lot of youngsters, we know you get exposed to lasers and peels in your PG time, but many a time the parameters might not have been set properly. So the results you get are in that grade. The lasers actually give you good results when the proper parameters are selected and done accordingly. That is the same thing with any of the treatments. So depending on each of our patients, as we discussed earlier, we have to spend around 30 to 40 minutes discussing with the patient. Sometimes what we see on the patient wouldn't be their concern. They would want an entirely different thing. And then their budget would be a huge thing. So we have to understand all these things, and depending on that, we have to plan, or the treatments have to be tailor-made depending on each patient.
As I'm told, the tailor-made treatment and the tailor-made technique, we are not getting trained during our postgraduate course. And even the training time also, like we'll be seeing so many institutes providing training.
Like one-day workshops, then there are observerships and all these things. So you should actually get properly trained under a mentor who is well experienced, who has great and vast knowledge and experience in doing the procedures. Spend enough time with them. It's not something which happens over 1 or 2 hours. You may have to spend maybe days or weeks or even a month with somebody to learn, because it's not only just the consultation or just doing the procedure, but even the aftercare. That's very important.
In a one-day workshop, you might see some techniques, some injection points, but what the patient is supposed to expect, how to counsel the patient, what are we going to see after a few weeks. This we'll understand only if we spend more time with the mentor, see the patient when the patient comes for follow-up, even handling complications. This we'll understand only if we spend more time.
So that is why we need to have that kind of proper training. So, and make sure that you are not going to those places which are where the trainers are not properly qualified people, who would be just dentists or who would be training you dermatologists along with beauticians and these BDS people. So make sure that you are getting trained under somebody who is well experienced, who actually teaches you properly. You get enough hands-on experience. You get to discuss, decide, and then learn the proper techniques and properly incorporate them in your practice.
And how to combine the procedures. That is also very important. Not one procedure is going to solve all the problems. So combining procedures is something you can learn from well-experienced mentors.
So learn this, and that actually makes you your own kind of experienced a person, an experienced injector who can incorporate and develop their own individual techniques. It's not just about converting a patient. It's about incorporating or delivering the proper treatments rightly to a patient, understanding them, understanding their concerns, understanding their affordability.
Thank you.